Hi everyone. I am going to introduce you to how blockchain technology can be applied to orthopedic surgery processes. Before that, let's first take a look at the current implant operation processes and the existing challenges. Conducting implant operations involve a series of processes and procedures, and also requires collaboration among different parties, including patients, surgeons, implant manufacturers and insurance companies. At the beginning, patients are required to undertake an orthopedic evaluation. An orthopedic surgeon will review the medical history of a patient to evaluate the general health and risk, and a physical examination will be conducted to assess joint motion, strength and stability. Advanced imaging, such as a magnetic resonance imaging (MRI) scan, may be needed to determine the condition of the bone and the soft tissues of the skeleton. Information, including patient's data and the implant requirements, will be sent to the overseas implant provider for making the implant. However, there are several challenges related to transparency, privacy, security, and interoperability, which is explained in the following. First of all, there is a lack of transparency between all parties involved. Patients have no immediate access to their health records diagnosed by the surgeons. Surgeons are not able to share data quickly across different organizations and hospitals. Insurance companies can only access patient information through a claim from the patient. Secondly, health data are highly privacy sensitive, especially as more data is being stored in public clouds, raising the risks of data exposure. Thirdly, the information system used in hospitals is centralized. Stakeholders outside the hospitals are not able to access the data, which means the hospital owns patients' data throughout the orthopedic surgery. Finally, the chance of mistakes increase due to the involvement of the large number of stakeholders during the process. The effective integration of health data and the interoperability between healthcare systems remain a challenging task. To deal with these challenges, blockchain technology can be applied. By using blockchain technology, patients have full control on their personal records. They can authorize different stakeholders to access to the considerable level of the history of patients, design of implants, and patients' records throughout the clinical and development process. All data are encrypted on the peer-to-peer network using a tree-based approach in cryptography and computer science called the Merkle tree. By using this approach, all data are encrypted using hash functions, which is an effective measure to detect changes, so that once a piece of data is modified, the action can be detected easily by traversing the tree. Blockchain technology also allows immediate data sharing between different nodes, once their access right is granted. Apart from dealing with the existing challenges, blockchain technology brings another advantage to the process, which is providing a platform to run smart contracts. Smart contracts are self-executing contracts in a blockchain network. The contracts are usually converted to computer code, stored and executed by the blockchain network. In implant surgery cases, patients can share personal data with other stakeholders, and be compensated by a token in return. The smart contract can be executed once the patients satisfy certain terms of the insurance contract in order to pay for the surgical fees. Transactions among patient, surgeon and the insurance company are validated by proof of work in the blockchain network. In conclusion, blockchain technology can effectively improve data sharing among different parties. In order to improve collaboration in implant surgery for better facilitating implant operations processes,